DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. We're going to have a great show. We're at NCBA and I've got Dr. Tim Parks and Dr. Dave Sjeklocha, and we're going to talk about bovine respiratory disease. It's going to be a great show. We're glad you joined us. Stay tuned.
They're here, they're hungry, and they can't be stopped with ivermectin. Choose Safeguard when you deworm your cattle to take out resistant parasites like brown stomach worm, Cooperia, Nematodyrus, and others. With Safeguard's efficacy, you can kill more resistant worms in your cattle, so you don't leave potential on the table. Consult your veterinarian for the diagnosis and treatment of parasitism. Then bite back at safeguardworks.com.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome to DocTalk. We're down in Nashville, Tennessee, and I bumped into my friends and colleagues from Merck Animal Health, Dr. Dave Sjeklocha, Dr. Tim Parks. They're both technical services veterinarians for Merck Animal Health. Great friends, great practitioners who now have a job that they can amplify and help us understand so much more. But we're going to talk about bovine respiratory disease, guys, and thanks for being here.
Thank you.
It's great.
Thank you.
So, Dr. Tim, when we start thinking about BRD, it doesn't start when they get to the feedlot.
No, BRD starts when that calf's born. The opportunity for changes that calf comes up against, we can start to see disease processes early. And if we look at some of the data, we know that there's a lot of cattle that are harvested with lung lesions that were never treated at the feed yard. So damage is occurring at some place. So we've got to start early in that calf's life to try to get them ready for the various stages. And vaccines play a big role in that. So when we think about vaccines, we always want vaccines to be the prevention of disease, but as we move into the phases, having a strong, healthy immune system also becomes a key component to success of treatment when we do need to apply a therapeutic to a case of BRD.
So when we're looking at these calves, whether it's baby calves and preventing summer pneumonia or branding time or preconditioning, all of these are helping build that what we call active immunity.
Yeah.
So that they either don't get sick, or when they do, they have an immune system to fight against it.
Yeah, and we have a window in that calf's life early where we're bridging between that acquired immunity that they get from mom through colostrum, and now we've got to start building active immunity. As we look at products available to us, intranasal vaccines have really changed when we may interact with that calf, because we can interact much earlier in that calf's life if we're up against disease pressure and still create active immunity, create immunologic memory that really sets that calf up to where now when it sees another vaccine or when it sees disease challenges, it's ready to have that amnestic response, that booster response that really accomplishes the level of protection that we're trying to achieve.
The reason why we get paid more is because this actually works.
Yeah. If we can improve the overall health of that animal, with BRD being one of the key drivers that we look at, you see production changes. They perform better in the feed yard. They perform better all the way through. And at the bottom, at the end of it, it's more beneficial for everybody.
Are there any other practices there? You deal with a lot of ranch calves.
Yeah.
What other things do you see that are important prior to arrival for helping with that calf's immune system?
Before that calf leaves the ranch, if it knows what a water tank is and if it knows what a feed bunk is, that animal has a much better chance of having success when it leaves. If we can wean them for 45 to 60 days, it really has a much better chance, because now once we take milk and mom out of the equation, it really changes how things are going to look when we start vaccinating animals, because of the various challenges they're up against. So anything that we can do pre-shipment is important, and nutrition's a big part of it.
Well, we're in Nashville, and I think that's going to be the title of a new song. When you remove milk and mama, you're going to have issues. But we're going to take a break for your NCBA. Dr. Dave Sjeklocha, Dr. Tim Parks, BRD. We'll be right back. Hey folks, Dr. Dan here. Welcome to your Cattle Intel by Neogen. Today we're going to talk about something we have talked about for a long time, injection sites of cattle. The injection site for cattle is this injection site triangle that is located between the vertebral column, the point of the shoulder, and the nuchal ligament. Anywhere between the skin and the skin on both sides in that triangle is nothing but muscle tissue. We want to make sure that we provide those injections in that triangle. The other thing is, don't inject more than 10 to 15 cc's per site at any time, and depending on label of the product. And the second one is making sure that when you do space injections, space them about a hand width wide between, so that they have proper area to develop and distribute the product that you're injecting. Make sure that you use the proper needles. Make sure that you use sub-Q or IM, depending on what the label of the product is. Always work with your local veterinarian. And this has been your Cattle Intel Minute by Neogen.
Cattle face stress during everyday events such as weaning, sorting, vaccination, and even weather changes. Cattle Zen delivers a patented blend of 2 pheromones in a single site application for fast-acting, long-lasting calming. It helps reduce stress to support performance and profitability, enhances cattle welfare, and improves safety for animals and handlers. Cattle Zen suppress the stress with every breath so you can both breathe easier.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Folks, welcome back to DocTalk. Dr. Dan Thomson here in Nashville, Tennessee at NCBA. Dr. Tim Parks, Dr. Dave Sjeklocha. They're veterinarians, technical services veterinarians from Merck Animal Health. And saying that they provide service for our industry is an understatement with all the things they've done in practice, the boards that they serve on within our profession. Just a lot of good things from these two. Dr. Dave, when cattle arrive at the feed yard, if we miss some of the stuff that Dr. Tim was talking about, we've got to do something to kind of play catch up, right?
Sure. Yeah, that's a thing, and I can't reiterate how important it is. Something that Tim touched on there is if those calves know what a feed bunk is and know what a water tank is, and there's a big piece of that battle that's been won. But they year in and year out, I just and when I was in practice, I just didn't see that many calves that knew what a feed bunk was or a water tank was, and you had to educate them. So of course, one of the best tools we have for dealing with a calf like that does not have that background is metaphylaxis, and we've got some excellent antibiotics for metaphylaxis that have been around for years. Talithromycin, of course, Merck's product is called Aravin, but we've used those and seen great success in reducing morbidity and mortality using those products. And it's I've even seen times where the cattle that received metaphylaxis actually came up on feed faster than they typically have if we hadn't used metaphylaxis. So there are some benefits to it. I still believe that we need to use our antibiotics judiciously, though. But I just like to point out that metaphylaxis is an excellent tool, if it's used right, and can provide a huge benefit to us.
Yeah, and as you were pointing out, that if you look at all the industries out there, metaphylaxis mimics running something through the water line or through the feed, or
Yep.
and we just can't find all the subclinically ill cattle. That's the reason why we call it metaphylaxis and not prophylaxis.
Exactly. Yep.
And so it's not unusual to see added performance at the end of the feeding period.
Yep.
By using an antibiotic up front, right?
Absolutely. And the more cattle that we can keep from getting sick, or at least reduce, for lack of a better phrase, how sick they get, the better those cattle are going to perform. And the way with what these cattle are costing right now, and and all the other things that are going into it, the longer days on feed, etc., the better those cattle can perform at the beginning through the whole feeding period, the better off we're going to be.
Yeah, I see it. We all see it. Cattle that now, that were what we would call medium risk, and that they're sliding into that slot where we're using more of an opportunity to help those calves, because you save one, you save two.
Yeah.
I mean, now we're talking $5,000 to $10,000.
Yeah, absolutely. Absolutely. Well, what is medium risk anymore? With the value of those calves, it's not just the calves that are sliding into, it's the value of those calves are making them higher risk, just simply because of what losing one animal can do to your bottom line.
Yep. And we talk about risk as though it's just associated with health. The health risk is associated with financial risk.
Absolutely.
And that's what we're trying to help set up. All right, we're going to take a break. When we come back, more with Dr. Tim and Dr. Dave here on DocTalk. Stay tuned.
In a world where every decision
is brought to you by Identity.
I think that probably the most important trait for any commercial producer to think about when they're doing genetic selection is stayability. So stayability is how long do we expect a cow to stay in the herd, right? Our economist friends tell us that a cow has to reach this age of about 6 years old before she becomes profitable. So in that case, right, she's recouped the costs of her development, she's recouped her annual maintenance costs, and only then does that cow start to be profitable. The good news about stayability is that it's genetically heritable, right? It's one of these lowly heritable traits, so somewhere between 10 and 20% heritable, but it's probably one of the most important economic traits to a commercial cow herd. So if we can find bulls that will make cows that stay in our herd longer, we ultimately are a more profitable operation. So stayability is the most important trait for a commercial cow herd to keep their eye on.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson here in Nashville, Tennessee at National Cattlemen's Beef Association meeting. We have Dr. Tim Parks, Dr. Dave Sjeklocha. They are technical services vets with Merck Animal Health. I have worked with them for many years in my career, and it's always a joy to spend time with them. And I've got to spend time with them today, and we're getting to shoot a show, and it's about BRD, which is something that we all deal with all the time. But once we slide away from prevention, we slide away from control. Now we're into treatment, which is something that needs to be done early, right?
Yeah, identification becomes one of the keys when we start to think about just treatment of BRD, identifying them when they're sick. Cattle don't necessarily like tell us if they're sick. We've got to understand when they're sick, and if we can implement treatment a little bit sooner before we start to have lung consolidation, some of the damages, then the goal of that is that our outcome becomes better. And as we move away from the metaphylactic space, and now we start talking about treating post-metaphylaxis, then I think it becomes really important that you're working with your veterinarian to make sure that we're on the plan, have a plan in place for what we're going to use, because good evidence out there through studies that would say if we've used telanthromycin, which is by far the most common metaphylactic drug, that we probably need to we need to change groups on our first treatment. And I think that's some of the stuff that you really need to work with your veterinarians to make sure that when we do follow up, so we're judiciously using the antibiotics, like Dr. Dave said, that we're using the one that's going to give us the best chance for success when we give that first injection.
Yep. And so as we start to do that, then a key point, work with your veterinarian. They understand the class of cattle, they understand your labor, they understand your hospital system, all those different things that go into proper treatment. When we're starting to how long we do a post-treatment interval is important, right? Mm-hmm. And then what we use.
Yeah.
But,
in the post-treatment side, it's going to vary depending on what you used up front again, and that's something that between what the risk level of those cattle are may affect your post-treatment or post-metaphylactic interval. But when it comes to your post-treatment interval, really understanding how long does it take for this product to work, and is there a benefit to coming back with a retreatment? It seems like so many times we come back too early with a retreatment when we just haven't given the drug time to work. Go back to the prevention side. We want vaccines to prevent disease, but we've got to have an animal that can, once we kill the bugs or we slow the growth with an antibiotic, we need an immune system that can come in and start to clean the damage up. I mean, we don't get a cough one day and take antibiotics and we're fine the next. A healing process has to take place. So that's where that post-treatment interval becomes so important, that we're allowing the drugs to do what they need to without overwhelming the system.
Dr. Upson always used to say that antibiotic kills the bacteria. It's up to the animal to heal itself, right?
Absolutely.
And
yep. No, I agree with that wholeheartedly. And it's like Tim was saying there, once we get it on board, we have to give that drug a chance. If we just the very next day pull them again and pull them again and put a different drug into them, we've kind of shot the whole shooting match in a heck of a hurry, when that calf might need longer days of therapy to get them over that respiratory disease. So.
That's when I start calling it chemotherapy, not
absolutely
BRD treatment as we do it. But we're going to take a break. When we come back, we're going to talk about ancillary therapy and how to take care of those calves in the hospital.
When it comes to treating BRD, you want a product that you can count on to get the job done at an affordable price. Macrocin by Bimeda delivers on both. A straight-shooting, no BS tulathromycin that does what it's supposed to do. End of story. You don't need to take our word for it, though. Go to macrocin.com for customer testimonials and head-to-head trial results. For your cattle and your bottom line, choose Macrocin.
I'm PJ Trowbridge. Me and my dad run Trowbridge Farms here in Ghent, New York, and we're using the Alertis on-farm pregnancy test.
The Alertis on-farm pregnancy test for us has been unbelievable time saver, especially on a beef farm. You don't have them in every day, so when that group of cows comes in, we can do it right then and there.
It is a very simple test to use. We have an internship program that we can teach the students within a matter of minutes how to use it. You can do 1 cow or 10 cows. It's really simple to use.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
When the ones who have your heart need your help, Count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Folks, welcome back to Doc Talk. Dr. Dan Thomson here with Dr. Tim Parks, Dr. Dave Sjeklocha. We're in Nashville, Tennessee at the National Cattlemen's Beef Association meeting. Dr. Tim and Dr. Dave are tremendous veterinarians. They're technical services veterinarians from Merck Animal Health. And, when we couldn't do this show without the partnership we've had from the very beginning from Merck Animal Health, and they believed in us, and so we just appreciate, and every time we get a chance to work together, we do it. And when we're talking about, first of all, what is ancillary therapy?
Ancillary therapy is just something above and beyond therapeutic antibiotic that we're putting in, something to try to change some physiological aspect that's going on. Usually fever. Fever is one of the key things that we focus on, but fever also we can be just overall general inflammation. Anytime we have a disease process, we're going to have a level of inflammation. Yep. Inflammation is what really causes a lot of the clinical signs that we see, and reduction of that inflammation can help enhance the treatments that we're talking about. Banamine being the key one that we talk about, Banamine transdermal that we have, or Resflor Gold, where we have a fluorophenocal product that contains Banamine in it to help reduce the fever, get those animals feeling a little bit better, hopefully going back to the feed bunk, back to the water bunk, and then allowing the drugs the antibiotics to work better.
We use a ton of Resflor Gold in our practice, and we also set up, if we don't use Resflor Gold, we set up a fever gradient for treatment to add Banamine to the platform when we can. But the antibiotic and the ancillary therapy is only as good as the way we house them, right?
Absolutely. Yeah, I've always been a big coach on management first and then medicine, and that's the thing. When I look at feed yards, a lot of feed yards, they'll refer to their place where they keep their sick calves as a sick pen, or some of them will refer to them as a hospital. Of course, I prefer the term hospital. And you think about when you go to a hospital, what do you expect? Well, you expect a comfortable place to rest. You expect food that might be conducive to healing. You can expect someone to come check on you from time to time, whether it's a nurse or a doctor. And then you finally, you expect therapy that will actually get you over the disease. And so that's what I always encouraged my feed yards I worked with is let's not make it a sick pen. Let's make it a hospital, and let's meet those criteria to make it a hospital. And so again, I just encourage people, if you have a pen on your operation where you keep sick cattle, make it a hospital.
Yeah. And whether we're talking about, that's the first place I'd put shade. That's the first place you put the windbreak and pile your corn stalks in the winter to make a windbreak. But just everything that Mom did for us to warm, hydrated, fed, chicken noodle soup.
Yep.
Yeah, it's great. But any last words on BRD, guys?
Yeah, BRDs, it's one of those things. I always joke, we both graduated in 94, and we still treat the same number of cattle for BRD that we did back then. So I think we've done some good, but at the same time, there's still work to be done. And it's just one of those things. I think he brought up a key point. There's management involved. It's not, everything's not in a bottle. I mean, we wish it was, but management plays a big role in it. So there's a lot of things that need to be done. Working with your veterinarian is key. We always stress that. That's where there's such a source of information to be able to help us to accomplish all the things we want to.
I would agree. Good management does not come in a bottle.
That's exactly right. Well, folks, thanks for watching Doc Talk. Remember, if you want to find us on the web, you can find us at www.doctalktv.com. Always work with your local veterinarian. From Nashville, Tennessee, I'm Dr. Dan Thomson with Dr. Tim Parks and Dr. Dave Sjeklocha, and we'll see you down the road.
At Merck Animal Health, we support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.